What are arteries? The human body is made up of arteries that are muscular and elastic hollowed tubes that must transport blood under a high pressure exerted by the pumping action of the heart. An artery in the body must serve as a conveying vessel that carries blood high in oxygen content away from the heart to the furthest reaches of the body. But it is not all good and sharp. Sometimes the artery is not allowed to function at its total capacity. This is mainly due to life choices such as cigarette smoking, heavy alcohol consumption, lack of exercise, or health conditions such as diabetes, obesity, chronic infections, or genetic susceptibility to high cholesterol. These things result in a clogged artery. A heart attack is the most common effect of having a restricted blood flow. In this episode of Brainfield, we explore spices to clean your arteries to prevent you from a heart attack. Be informed that this video is solely for educational purposes. If you suspect your artery is clogged, be quick to consult your doctor. Let's get right to it. Top spices to clean your arteries. Number 1. Garlic. Even when they are as fresh as possible, there is a bad PR that follows garlic. Most people do not like the taste of garlic in the mouth, but the body loves garlic. The components found in garlic could lower blood pressure levels in the human body. How is this helpful? Studies show that high blood pressure is a leading factor in cardiovascular impairments. Garlic at the same time helps reduce the level of cholesterol in the human body, and this, in turn, helps to reduce the possibility of cardiovascular diseases. However, garlic would only work for this function if it is consumed every day for at least 6 months. Number 2. Cinnamon. The good thing about this herb is that, like a couple on this list, you can easily incorporate them into your diet. You could grind the cinnamon and sprinkle it on your coffee or tea, or you could decide to use it in cooking as a flavoring agent. Cinnamon has a therapeutic effect on human health, specifically heart health. Cinnamon is a confirmed source of cinnamaldehyde. Cinnamaldehyde is known to have anticoagulant properties and comes in handy in preventing blood clots for people with a high risk of excessive blood clots. It also comes in handy in mitigating risk factors related to arteriosclerosis and heart disease. Taking as much as 6 grams of cinnamon a day can lower low-density lipoprotein, cholesterol, and triglyceride levels. Number 3. Turmeric. For every list of herbs and spices to help with the heart, the exclusion of turmeric makes a list grossly incomplete. This is because the turmeric spice is an excellent base for anti-inflammatory and antioxidant properties, which help reduce damage to the walls of the arteries. The primary cause of plaque buildup and blood clots is inflammatory actions on the artery. Adding turmeric to your diet prevents this. For a long time, the health benefits of turmeric were masked under the thought of it being just another Indian cuisine. However, it prevents your arteries from hardening over the years and developing fatty deposits. The benefits of turmeric are endless, far beyond the effect on the arteries. Number 4. Ginseng. If you are familiar with the name of this spice, you would agree that the first thought is that it is a natural blood thinner. Well, you are correct. How exactly does this spice help the heart? It is scientifically proven that this herb reduces the risk of heart attack and other heart conditions. It does this by improving arterial stiffness and unclogging heart arteries. While other herbs are helpful in reducing cholesterol levels in the human body, this herb does the opposite. It helps to improve patients' cholesterol profiles. It thins the blood and prevents platelet adhesion in heart arteries. Note that ginseng is not like other herbs. It requires strict usage because it cannot be consumed by all kinds of people, especially people with already high cholesterol levels. Number 5. Ginger. If you are looking for one of the less offensive herbs to take that help clean your arteries and prevent the possibility of a heart attack, then ginger is your pick. It is so inoffensive that people chew on it just for fun, as opposed to spices like garlic. What does it do? Ginger is an anti-inflammatory spice, just like garlic. It fights against situations where arteries begin to harden up. It at the same time reduces the possibility of abnormal platelet aggregation. This is known as excessive blood clotting, which could lead to insufficient blood being pumped to the heart. Moreover, ginger is a substitute for pain relievers like aspirin and comes without the side effects known with aspirin tablets. Number 6. Cloves. The most important thing you want to know about cloves is that cloves are a rich source of antioxidants that reduce oxidative stress. Oxidative stress has been linked to a number of chronic ailments, such as cardiovascular impairments. Additionally, it helps reduce the low-density lipoprotein cholesterol in the body. At the same time, it helps with atherosclerosis. That is, it prevents the hardening of the blood vessels that transport blood to the heart. Cloves are generally used in many recipes, making them easier to incorporate into the diet. Number 7. Parsley. Did you know that parsley is sufficiently loaded with vitamin C and vitamin B12? If you didn't, now you do. This is a good enough reason to begin optimizing this spice to its total capacity. What does this do? This helps to increase the blood flow through the arteries. But, as you might have guessed, it doesn't stop there. Parsley not only acts as a natural vasodilator but also contains nutrients that prevent its users from falling prey to atherosclerosis. More so, parsley is essentially high in folate. What this does is help reduce the levels of homocysteine and by extension, reduce the risk of heart diseases. Number 8. Thyme. Who would have thought that thyme had a secondary function other than serving as a great food dressing and scent inclusion in dishes? Well, this is the secondary function. Thyme is gotten from the mint family. It is an aromatic herb used to decrease harmful cholesterol levels, LDL, and has anti-inflammatory properties. But that is not all there is to thyme. Thyme has been studied over the years, and these studies show that it not only lowers blood pressure, but can also help reduce the level of fat in the blood. It also prevents tachycardia, fast-paced, and uneven heartbeat rates. Plus, it is an excellent substitute for salt as sodium. Number 9. Rosemary. Have you ever heard of rosmarinic acid? Rosmarinic acid is a natural polyphenol antioxidant with anti-inflammatory properties. As an antioxidant, it neutralizes harmful molecules called free radicals and prevents against oxidative stress, which can lead to decreased antioxidant defenses and increased free radical production. The rosemary is one of the few names on this list with rosmarinic acid. The acid, alongside other components in the rosemary, makes it a great pick. The rosemary spice helps lower blood sugar levels and increases glucose absorption into the muscle cells. This lowers the blood level and would be appreciated by persons with unique heart issues. More so, reducing sugar levels makes it an excellent inclusion for people with type 2 diabetes. Number 10. Cardamom. Cardamom is a spice known for its effectiveness in lowering blood pressure levels for those that struggle with constant high blood pressure. But before we go into that, where is the cardamom spice from? This spice is a native tea even before it began to be noticed for its medical use. It had constantly been used because of its peculiar sweet and spicy flavor. Cardamom is packed with antioxidant and diuretic properties, which help to reduce blood pressure for those diagnosed with hypertension. In addition to that, cardamom contains anti-inflammatory benefits, and what this does is reduce the frequency and possibility of an array of cardiovascular diseases. The good thing is that this spice could work as an inclusion with different types of meals. Number 11. Cayenne Pepper. Would you have thought that pepper, specifically the cayenne pepper, could be this beneficial to the body? If you didn't, you are not alone. Many people are oblivious to the health benefits of the cayenne pepper, and as such, they tend to shy away from eating it except when absolutely necessary. It would interest you to know that capsaicin is the most vital component of the cayenne pepper. Capsaicin is the component that makes the pepper as spicy as it is. The importance, however, is not limited to the peppery feel. Capsaicin serves as a natural vasodilator. It also helps in bringing high blood pressure to a lower rate. It also reduces cholesterol levels that would likely lead to a blocked artery. Number 12. White willow bark. History has presented that one of the most outstanding physicians of the old, called Hippocrates, recommended this spice in the form of tea to women in labor to help relieve the pain of childbirth. In today's world, we see the white willow as the inspiration for aspirin. Aspirin is formed from willow bark extract. This bark extract also helps with inflammation. Well, this is true, but many people do not know about the salicin effect in the white willow bark. This salicin is the main component of this herb. What salicin does is that it functions as a blood thinner and helps prevent the formation of blood clots in your arteries. It helps to improve the circulation of blood through the body, and this reduces the possibility of having a heart attack or stroke originating from insufficient blood flow because the arteries are clogged. Most of these spices can easily be incorporated into the food we eat every day. More so, a number of them, such as ginger, could be used as a butter substitute for pills. The next time you feel your head banging, you should know that ginger could help you. Which of these spices would you consider taking upon prescription, and which one do you think we missed? Tell us in the comment section. Please note that the purpose of this video is purely educational. It does not serve as a substitute for seeing a professional or adhering to the clear instructions given by a doctor. Till next time, we bring you another educational video like this. Today would be a good time as any to subscribe to this channel, don't you think?